Good afternoon. Dr. Dempsey here again on Call with Doc Dave. And today we're going to do a three-part, three-episode series. We'll start with series 18, then go to 19, and then go to 20. And the series are going to be consisted of the three different trimesters of a pregnancy. So the first series we're going to do today is called the first trimester of pregnancy. And it's pretty much going to be everything you really need to know about that, maybe even a little bit more, but it's going to have some good information on it. So the first trimester of pregnancy is technically the first 12 to 14 weeks of pregnancy from conception. And you measure this from the first day of your last period to week 12 to 14. Now, what are the physical changes you notice when you become pregnant? So first of all, your breast changes. You get a swelling, tenderness, your areola on your nipples become darkened, and you have some visible congested like veins that you'll notice on your breast. The second thing is you get a little uterine growth, obviously, as the placenta forms and the uterus starts to grow. And it presses against your bladder, so you have frequent small urinations. And it presses against also your intestine, which can cause constipation. So as uterus grows, you get a little bladder irritation and you get some constipation issues with your intestines. Now, the third thing is you get mood swings. Everybody knows that. And it's a hormonal alteration which causes your mood swings. Nothing you can do about that. You just have to adjust and live with it. Number 4, morning sickness. That dreaded morning sickness usually comes on at the 4th week. And again, it's by hormonal causes, nausea, and vomiting episodes. And we're going to go into that more detail at the end of this episode, but I just wanted to bring it up now. Number 5, constipation, again, because of the pressure of the uterus on the intestines. Number 6, you get a little vaginal discharge. It's usually, clear to slightly whitish in nature, doesn't have an odor to it, there's no blood in it. It's called leukorrhea, and it's normal with developing pregnancy. Number 7 is fatigue, again, hormonal changes. And number 8, you get a little vaginal bleeding, a little spotting, no clots or active heavy bleeding. That's a different thing. You just get there's a plug that opens up in your cervix, and there's a little bleeding that comes out. It's nothing to be concerned about. It's totally normal in your first trimester. You also get a weight gain, anywhere from 3 to 5 pounds in that first trimester. Your heart rate goes up a bit, as does your respiratory rate. So your heart rate maybe in a normal person is in the low 70s. Yours may be in the mid 80s or 90. Respiratory rate in a normal person is anywhere from 12 to 14. Yours might be 16 to 18. And they say the most difficult week of the first trimester is usually in the 8th to 9th week. Your craving, you always hear those old stories, I want pickled ice cream, I want this, that, or the other. That usually comes on at about the 5th week. So those are the physical changes you'll notice with your first trimester. Now, how do you care for your first trimester? What do you do to, protect your pregnancy and to make the formation of the fetus more healthy? First thing is prenatal vitamins. Prenatal vitamins. You will get those from your physician, and it's obviously good for nutrition, and it's vitamins A, C, E, and folic acid. Those are the main vitamins that you'll get in your prenatal multivitamins. Now, the other things you can do to care for your first trimester pregnancy are small, frequent, bland food diet. This will prevent the excessive problems with morning sickness. So, you don't want to be eating heavy, greasy, spicy foods, because in your pregnancy, you'll find that if you have small, frequent meals every 1 hour to 2 hours, up to 6 meals a day, and keep them relatively bland and keep well hydrated with cold water, these will prevent some of the side effects from your morning sickness. Again, we're going to go into morning sickness in more detail shortly. Ginger products are really helpful for morning sickness as well. Now, the other thing you need is the supplement for your magnesium and your calcium in your diet. This is for leg cramping and muscle cramping in general. So if you add that to your prenatal vitamins, your multivitamins that have a supplementation of magnesium and calcium, this will prevent those crampings. Also, wheat bran and fiber for constipation. Okay, so those are things that you can do on yourself, by yourself, and with some addition from your physician. Now, what goes on with fetal development in the first trimester? This is really important, and this is interesting information for everybody. So, in the first trimester, all major systems and organs begin to be developed in the embryo. And it looks like the development of a tadpole. If you know what a tadpole looks like, that's what your baby, the fetus, is going to look like in the first trimester. What the developing organs and major systems are essentially what's called a neurotube, which is your brain and your spinal cord development. The intestines and digestive system start to develop. The heart and the circulatory system develops, and your first heartbeat can be heard generally around 6 to 8 weeks, and the eyes and ears develop. So all of these major organ systems, your heart, your lungs, your eyes, your ears, your intestines, your neurotube, these things are all starting to develop in the first trimester. So it's a pretty important time and a pretty busy time in the fetal development. You can do an ultrasound. Usually at the 11 weeks, you'll be able to tell if it's a male or female fetus. So that's interesting to know. And also, just a little sidebar, girls, if it's a girl, usually have increased morning sickness issues. So, now that you know about the fetal development, what are things that you should avoid in the first trimester to protect the fetal development? So, first of all, avoid strenuous exercises with strength training. Don't be lifting weights. Don't be, doing any strenuous exercises. Some yoga is okay, but you can't be at the gym doing things you did prior to becoming pregnant. Alcohol and smoking and drugs are an out. These types of input into your system will have a higher degree of a possible miscarriage or maldevelopment of the fetus. So no alcohol, no smoking, and no illicit drugs. The other one is caffeine. So you want to limit yourself to 1 cup of coffee a day or 1 cup of tea, because caffeine is a stimulant and it could stimulate a miscarriage if the uterus is contracted. And the last thing is any raw fish, any sushi, anything like that is an out. You don't want to be stimulating your digestive system and possibly eating some bad fish and precipitate the morning sickness even worse with having gastroenteritis and vomiting and diarrhea. Okay, now warning signs. What are warning signs of a possible miscarriage? Okay, constant increasing painful headaches is one of the things. Dizziness and fainting is another sign that you may be having some miscarriage potential. Visual changes, a fever, any respiratory distress with increased palpitations in the heart and increasing respiratory rate and distress. Any increasing abdominal pain, specifically located to the right or left lower quadrants of the abdomen. This could be a sign of a possible ectopic pregnancy, which means a pregnancy outside of the uterus, either in the fallopian tubes or the ovaries, which could be very, very dangerous. Any vaginal bleeding other than the little spotting that you'll notice in the first couple of weeks, I'm talking about passing clots, possibly passing a bluish tissue, or any heavy actual bright red bleeding is something that's you need to attend to immediately into the emergency room with your gynecologist. Seizures, any convulsions or seizures that you have. So, things that can also increase the chances of a miscarriage are obesity. So, if you're really morbidly obese and overweight, that has a high degree of miscarriage potential. And again, as I mentioned earlier, any smoking, drugs, alcohol, or caffeine should be avoided. So now I'm going to touch on the morning sickness in the first trimester, which is something that, almost everybody goes through. 85% of the people have morning sickness in their first 5 to 6 weeks. And morning sickness is basically just nausea and vomiting. The causes, again, are hormonal changes and odor changes, things you smell. You got a hypersensitivity to that sense, and that could precipitate nausea and vomiting. Genetics, it does run in the family. If your mom, grandmother had pretty significant morning sickness, you can be assured that you're going to have it as well. And if you had a history of similar and prior pregnancy, first pregnancy, morning sickness, second pregnancy, morning sickness, if this is your third pregnancy, be prepared. Now, the type of morning sickness that's a medical emergency is what's called hyperemesis gravidarum. And this is where you are just vomiting continuously. You can't hold down anything. You can't hold down cold water. The ginger isn't working. The small frequent meals aren't working. You're just vomiting. Everything that goes down comes back up. Now, this is very dangerous because obviously you can get dehydrated, and this could affect the baby, the fetus, and could cause a potential miscarriage. So you go to the emergency room, and they put an IV into you, give you hydration and antiemetics, and this usually resolves it. So the treatment of morning sickness, we mentioned it earlier, small frequent meals, 1 to 2 every 1 to 2 hours, 6 times a day, easily digestible foods, bland foods, what's called the brat diet. And you may know from your baby, if your baby's been vomiting, the brat diet is generally bananas, applesauce, rice, and toast. Cold water, stay hydrated. Ginger ale is very good, or any ginger products. Herbal tea. Electrolyte drinks like Pedialyte are extremely important. They have the sodium and potassium in there that you need. And also avoid strong odors, greasy, spicy, fatty foods. Avoid exercise after eating is a good idea, and increase sleep and rest. Chew your food well. It increases your digestion and helps prevent morning sickness. So these are things you need to know about your first trimester. I hope this was helpful and educational. And we're going to go into the next episode, which will be the second trimester, and then the following episode will be the third trimester. So, again, remember, I am your friend, not your doctor. If you like this episode, hit the like button, subscribe, and pass along, share with your friends that are pregnant or are going to be pregnant. And it's a good episode to pay attention to and learn from. So thank you, and I will see you again in the near future. Doc Dave signing out.